COVID-19 has made it very challenging for patients living with cancer, and they are really managing a very complex situations. And the work of patient advocacy groups is really critical in these days to support patients on their journey. I'm very, very pleased today to welcome Pat Garcia-Gonzales. Pat is the founder of the Max Foundation, and she has founded this wonderful group 15 years ago in memories of her stepson who courageously was fighting chronic myeloid leukemia, or CML. So Pat, you are always doing wonderful work, and I admire you and your teams for being present in now, I think, 70 countries and doing amazing work. And I have to say, this work is more critical than ever. And I cannot thank you enough that you took the time to be with me today and really spend a couple of minutes and share what we both observe. So maybe tell me a little bit, Pat, how is the situation? What do you see? And what are you observing these days?
Yeah, thank you, Susanne, and thank you so much for inviting me to have this conversation and for amplifying the voice of cancer patients, because I think that as a cancer community, COVID-19 stopped us in our tracks. And it was a complete crisis 2 months ago. And I think we need to learn as we move forward to coexist, to be able to treat cancer together with COVID-19. I'm very excited to talk to you today. As you know, and as you said, we have a very large program at the Max Foundation. We are caring for about 30,000 patients, mostly that have chronic myeloid leukemia in these 70 countries. And just to give you a sense, we work with 200 medical institutions in these countries. Half of our countries are in Africa, so we have patients in about 30 countries in Africa. And then all throughout Latin America, the CIS region, and Asia. And then I'll have to say, half our countries are in Africa, but half of our patients are in India. So we have a very large program in India. And as you know so well, chronic myeloid leukemia is a disease that you can treat very well with really awesome oral cancer medications. And patients can stay on these drugs for many years, doing very well. But of course, they need their daily treatment. So generally speaking, our patients go to see the doctor every 3 months, and they get their checkup and they get their medicine. And as you know so well, in low and middle income countries, the cancer treatment is very centralized. Many countries have one cancer treatment. So these patients come from very far away every 3 months. They sometimes have to spend 10 hours, 12 hours on the bus to get to the doctor, get their medication, and go back home. And so what happened about 6 weeks ago is one day they woke up and countries were in lockdown. And so nobody is allowed to leave their house. Nobody is allowed to, let's say, be on a bus. Transportation and mobility completely locked down. Hospitals, where our partner hospitals are all the public institutions. So they were converted from one day to the next to COVID-19 hospitals. So it has really been a very dramatic and scary experience for our patients. And we started receiving just hundreds of calls every day of people asking us to help them get to the medication. And it has been very difficult for patients to figure out how to be able to continue their cancer treatment.
And what are your strategies to mitigate, or what are you doing? Because I know that you're so active, you are not giving up even in these days.
I have to say, I have a small but very, very dedicated team. We have about, you would think with 30,000 patients, we have a very huge team, but it's very small. So we have about 50 people that run the program. And they are in touch with patients every day. So from the first day, really trying to problem solve however we could to make sure that patients could get their medicines. We are lucky to have amazing partners at all levels. The healthcare providers are very, very dedicated to these patients. And as we solve the daily problems of patients who are stuck somewhere and need to be able to how to get their treatment, we are looking in the not today, but tomorrow, just start to be able. So, okay, how can we bring now the treatment to the patient? When we think about treating cancer in low and middle income countries, my personal opinion is that the last mile is bringing the patient to the treatment, because we want people that really know how to treat these cancers to be the ones treating the patients. But at this time, we had to shift to make sure that the last mile does become bringing the treatment to the patient. And the ingenuity and the commitment of everybody on the ground has been very heartwarming. A lot of some physicians are calling on to the police to bring the medicine to patients, because the police are the only ones that are able to circulate. So they have sent medication through the police. Some patients are trying to hitch rides in ambulances to bring them to the hospital. We worked with physicians and tried to make sure if a hospital is closed, that the security people in the entrance have a list of our patients and that they are allowed to come in. So all sorts of really one-on-one problem-solving solutions is what we have been doing in the last few weeks as the new normal right now.
But really amazing, Pat. I mean, it's unbelievable what you and your teams do. I mean, you are also a quite active patient advocate, and probably you talk to many colleagues. And I realize I also get a lot of requests, also from friends who have, relatives or loved ones with cancer. Any advice you would give? I know for you, your philosophy is also network is important. Any advice also what caregivers could do to support patients and how to best navigate?
Yeah, we are all in this together. And the truth is everybody's frightened. Everybody is in crisis. I truly believe that the best thing that anyone can do for a cancer patient is allow them to stay home right now. If we can give the gift of allowing the cancer patient to be safe at home and not have to expose themselves going anywhere, I think this is the best gift that we can give. So, of course, reaching out to patients since they are stuck at home, making sure that they're okay. And if you have a neighbor or you have a loved one, bringing them groceries, figuring out how to get the medicines to them, and really allow them to be the safest place for them right now is staying at home. Since they have a little bit more compromised immune system. And then, of course, a lot of education. I feel as a global community, all of us have learned so much in the past 2 months. We are becoming very experts, but there's a lot of misinformation and different things being told on the web. So as a patient advocacy community, I have been very happy to see how immediately we're all finding the really good sources of information that we can help the patients understand what's true and what's not true, and try to decipher for themselves what to do. But it's an unusual, really unimaginable situation for many of us.
Yes, it is.
But I think that we are coming out of it with innovation, and I think we're finding things that we never thought we could do, and yet it was possible. So imagining really what is possible, and I hope that as the pandemic goes away, we will keep some of these innovations. You know, one of the first things we ran into was in many of the countries where we work, there's no, they don't have yet electronic prescriptions. And they've had to shift so quickly. Something that was completely not possible before now is possible. So it was really possible, right? And so we have moved to electronic prescriptions and telemedicine. And, you know, at the end of the day, I hope that this will help us evolve in the future of some of these things that were not so impossible as we thought.
Yeah. And maybe, Pat, I think as a last question, let me just ask, I mean, we are all struggling and through this situation with COVID-19, but let me just ask you, what gives you hope these days?
You know what gives me hope, and I have to say, all of us go from hope to not hope some days. I think it is important to recognize that we're all stressed and trying to understand the future and trying to visualize the future is not so easy right now. What gives me hope is the commitment, the resilience of the human spirit. What I see, patients helping each other and people helping each other. And I have great hope that the researcher community, that the world can act all at once and find a cure for this disease. And so I know we will overcome. I know we are all very resilient, and I know we will overcome. So I think we just have to hunker down for a little bit longer and really try to understand. To me, it's very important that as we move in the next phase of this pandemic, that we as a cancer community find our voice again, because I think we lost it for a moment. Even for us, it seemed 4 weeks ago or so that it was not okay to talk about cancer because people just wanted to hear about COVID-19, but we're finding again our voice. And so of course, I know we will overcome this, and working all of us together.
So, Pat, thank you so much for taking the time with us today. I mean, I'm always so impressed about how your team works, the creativity, the solution-oriented mindset. I mean, it's incredible. And I'm sure your words have inspired and encouraged many, many patients to continue fighting this disease.